New South Wales has recorded 7 further COVID-19 related deaths, including a man in his 20s, and 1,262 new locally acquired cases. Warm weather in Sydney again today has prompted large crowds to head to the beach. Jane Kennedy reports.
I'm down at Bondi Beach in the Waverley local government area, and I can tell you that the beach is heaving. It's a very, very warm day in Sydney today, as it was yesterday, and the beaches were packed yesterday across Sydney today. In fact, in the neighbouring local government area, we had a couple of the beaches closed yesterday to new arrivals. But there's not a lot of social distancing going on here. There's not a lot of mask wearing. And yesterday, when the Health Minister was asked about the people flocking in droves to the beach, he did certainly appear to defend the beachgoers to some degree. He said he was more concerned about unvaccinated people and that being outdoors, as long as they were social distancing, was a safe option. Now, the state's Chief Health Officer, Dr. Kerry Chant, was asked about that today. She expressed a little more concern, as did the Premier. We might have a listen to the Chief Health Officer, Dr. Kerry Chant.
Many people who are living in southwestern Sydney and Western Sydney don't have access to that because of the restrictions. So for me, that causes me some concern, because clearly I'm asking a lot of the people of southwestern Sydney and Western Sydney. But in reality, outdoor environments, if people are keeping away from each other, are probably the safest environments. I would like to see that people are really respectful and that they are adhering to the public health orders as they move about, if they're walking along the beach. But I would not want crowds, people engaging, people socialising. That is not what we need at this moment.
The Mayor of Broken Hill in far west New South Wales says regional areas are concerned about how they'll cope with an expected peak in COVID cases. Mayor Daria Turley says she can't believe the Premier is stopping daily health briefings.
We're about to hit the peak. We're about to go in the toughest time, and Broken Hill in the last 3 days have felt that. We've seen the communities of Wilcannia, where we've had to have convoys of accommodation come in. We've got our health workers that are being burnt out. We're going to have PTS, post-traumatic stress, I believe, in the future. I know other people do. I'm really worried about what's going to happen in the next couple of weeks and what is the big picture. And I think good public health policy needs to shine through. We've seen it with HIV and AIDS, where the country came together, and at the moment I feel we're divided into the poorer suburbs versus the richer.
1 million doses of the Moderna vaccine will arrive in Australia from Europe in the next week. It comes as Australia's Technical Advisory Group on Immunisation approves Moderna to be given to anyone older than 12. Prime Minister Scott Morrison says the vaccines have been donated by countries where there's a surplus.
And that means everyone from 12 to 59 can go along to their community pharmacy where Moderna is being administered, and they'll be able to go and get a family jab. They'll be able to go along to their pharmacists, family members, kids, parents, and be able to get that jab at their pharmacy. These doses, plus Australia's already contracted supply, will be shared around 3,600 community pharmacies across Australia. And up to 1,800 pharmacies will begin to receive doses through the week of the 20th of September. I particularly want to thank the governments of Spain, the Czech Republic, Portugal and Bulgaria, as well as the European Commission for their cooperation as we've worked through the arrangements. I also want to thank Moderna for their support for these arrangements, and as well as Norway and Sweden who have helped facilitate this deal over the course of these last few weeks. These additional Moderna doses, of course, come in addition to the 4 million we're able to secure in the arrangement with the United Kingdom with the swap there, and the 1 million we're able to secure from Poland in the direct purchase arrangement we had there, and of course the 500,000 in the swap arrangement we had with Singapore. Now, these additional doses will also provide a role in providing additional support for Victoria. Residents in particular in Melbourne's north and west will benefit from additional vaccines and a rapid expansion of vaccination sites across the region as part of a 3-week vaccination blitz there in Victoria to deal with the surging Delta outbreak there. To assist these communities and all Victorians, Minister Hunt and I have agreed that the Commonwealth will surge more than 400,000 additional doses of Pfizer and Moderna in Victoria over the course of September.
Victoria has recorded 392 new locally acquired cases of COVID-19 as concerns grow over cases in regional areas. Of the new cases, only 107 have been linked to known outbreaks. In some better news, state clinics are reporting a record number of people showing up to be vaccinated.
We now have 3,112 active cases across Victoria. All but 4 of those are locally acquired. 85% of those active cases are under the age of 50. So again, we've said many times that this is everybody's business. This is not just something for the frail aged, as important as that group in our community is, but this is something that is really targeting, if you like, almost those who are not vaccinated. That's the nature of a pandemic of the unvaccinated. That group is still too big for us to be able to open up, but as we slowly decrease the number of people who've not been vaccinated, so get the vaccination levels up and up to hit those 70 and 80% thresholds, we have many more options, of course. That's why it's so pleasing that we had 36,534 doses administered yesterday at state sites. That is the biggest Saturday by quite some margin since we began rolling out these vaccinations. 65.2% of the eligible population has now received a first dose. So we're rapidly approaching that 70% first dose marker, where we have indicated some modest easing will be possible. To go further than that really will be very, very difficult, but we aim to be able to deliver all of those changes that we had indicated a couple of weeks ago. There are 147 Victorians that are in hospital. 34 of those are in intensive care and 28 of those are on a ventilator. Of the cases in hospital yesterday, only 1 was fully vaccinated, and I don't believe that's somebody who's on a ventilator. The key point here is that getting vaccinated works. It is incredibly effective against the transmission of this virus and against serious illness. There are appointments available. Please go and book one.
Western Australians aged 12 and over will be eligible to receive a COVID-19 vaccination from tomorrow in a bid to boost the state's vaccination rates. It means from Monday, children aged 12 to 15 can be booked in to receive a Pfizer vaccination at a health clinic or GP. It comes as the South Australian Government announced yesterday it will be opening up Pfizer eligibility to anyone aged 12 and over, including those over 60. In WA, the government says current health advice recommends AstraZeneca as the preferred vaccine for the over 60 cohort.